Hi, this is Dr. Doug Willen, and this video is about the 8 health benefits of probiotics. And probiotics is a big thing, and if you ever want to get your gut right, you got to know about probiotics, and many of you watching this, including myself, should be taking a probiotic in today's world. But probiotics are a live microorganism. They're what we call a good bacteria that can be consumed through fermented foods or supplements. More and more studies show that the balance or imbalance of bacteria in your digestive system, in the ecosystem of the world in your intestines, is linked to overall health and disease. And we have a lot more going on in our bloodstream and in our intestines than you ever dreamed possible. I like Dr. Seuss as a kid, and I love the story of Horton Hears a Who. And Horton's that elephant, and they find in like one little like dandelion particle is a whole world. And there's people that live down there, and you know, it's this whole system. And our gut is like that, and so is our bloodstream. So our blood isn't just red water in a pipe. And our gut isn't just a tube that food passes through. There's a whole world of microorganisms in there that aid us, or in some cases are detrimental to the way that our bodies function and respond to disease and our ability to have health at the highest potential. So probiotics promote a healthy balance of gut bacteria and have been linked to a wide range of health benefits. So let's dig through and you'll see for yourself. Number one, probiotics help balance the friendly bacteria in your digestive system. And this is so important because almost every disease that you could possibly think of would either be benefited by a better working gut or impeded or held back from doing as well as it could if the gut is not right. Throw any name of a disease at me, that person would do better if the gut wasn't a problem. So I'm not saying that the gut will be a problem with every issue, but get the gut right. It's always a good idea. And that will help your longevity and your health no matter what you're battling. Because very often my patients and people that send me emails are saying, I have XYZ disease, and they can even name a disease I might not have ever heard of. So if I did have a chance to ask them questions, I'd ask them things. How's your bowel movement? How's your food? Your intake? How's your digestion? How's your stamina? How's your sleep? Are you drinking water? Are you exercising? The basics. And if one of the basics, your digestive tract is off, I'm concerned, and so should you. So this is a little blurb on good bacteria. Good bacteria, also known as beneficial bacteria, are defined as any bacteria that are beneficial to the body and enhance health. So when we hear bacteria, a lot of times we go, oh my God, disease. But no, there's actually good bacteria that helps the ecosystem of our gut perform at its highest level. One of the most well-known types of good bacteria are probiotics. Actually, most bacteria are good, comparatively speaking, and there are only really a handful of bad bacteria out there. An imbalance means there's too many bad bacteria and not enough of the good bacteria. So that tilts the scale, right? It can happen due to illness. A lot of medications will disrupt that beautiful balance of good and bad bacteria in the body. Antibiotics can knock that out for us, and definitely a poor diet with refined carbohydrates and refined foods of any type will knock that out. So probiotics, number 2, can help prevent and treat diarrhea. So that is something a lot of people don't know. So if you're the type of person that always has a loose bowel or frequently has a loose, watery, upsetting bowel, or something that you're not forming a healthy looking stool, you might consider putting probiotic into your life and at least take it supplementally, try it for a month, see how it works for you. Probiotics are widely known for their ability to prevent diarrhea or reduce its severity. Diarrhea is a common side effect of taking antibiotics. So if you've been on antibiotics off and on, let's say you have Lyme's disease, or you've been fighting sinus infections, bronchial infections, if you're using antibiotics as a secondary to bigger things, like when someone has COVID-19, they're also trying to, and they're in serious condition, they're also worried about secondary infections coming in on top of the COVID-19, making everything worse. And very often you're going to be on antibiotics while you're fighting COVID-19, the antibiotics being for those secondary infections. But you might all of a sudden now have the side effect of diarrhea because you're on the antibiotic. Not a bad idea to start working those probiotics, and especially when you're especially when your course of antibiotics runs out. Some people are on antibiotics. I'm not talking about COVID-19 right now, but I'm just talking about in general. You have a sinus infection or something that your medical doctor puts you on antibiotics. You're on it, let's say, for 7 to 10 days. Get on a probiotic as soon as that's done. Diarrhea is a common side effect of taking antibiotics, as we said, and just something worth learning about. Probiotic supplements improve some mental health conditions. I mean, how could that be, right? How could taking something that you think is for your gut help your mental health? But the truth is there's a lot of scientists today that call our gut our second brain, because so much of our nervous system, the nerves of our body end up in the gut. And so you can get a feedback loop. You have information going from your brain to wherever those nerves go, but you also have information from the tissue of the body sending information back up to the brain. And if you're a person that has Crohn's disease or fibromyalgia or irritable bowel or colitis or ileitis or any type of inflammatory bowel, you're going to be battling the challenges of mental health. Maybe you're someone that really doesn't notice it, but most of the people that do find that they also suffer from melancholy, mood swings, and in some cases, depression. So let's go to the next slide. Research shows that taking probiotics may help improve symptoms of mental health disorders such as depression, anxiety, stress, memory, among other things. And this is one of those products, like, you just can't go wrong taking a probiotic. You know, it should be in I think it should be in everybody's everyday arsenal. So people go, I take a multivitamin. I don't even know why I take it. I just take it. Well, good for you. That's okay. Take the multivitamin. I like that. I even make a multivitamin. So it's not something I'm against. But also take a probiotic. Also take a vitamin D. Also take a fish oil. Have 4 or 5 things in your daily regimen that supports some of the missing pieces or some of the pieces that you want to strengthen and stabilize and bolster to give you your best chance of expressing health at its highest level. A review of 15 human studies found supplementing with bifidobacterium and lactobacillus strains for 1 to 2 months, just 1 to 2 months, can improve anxiety, depression, autism, OCD, and memory. Now, I bet the probiotic you're taking already has the bifidobacterium and lactobacillus. That's the 2 most common that are going to be in all your probiotic products. I definitely have it in the one that I make, but I'm not the only one that makes a good product. There's a lot out there. So if you love the one you take, keep taking it is what I'm saying. Or if you have one on your shelf that you never take, get it out. Start taking it. Let's go to the next one. So where did I get that study? So sometimes I get emails that go, oh, you put up a study or you mentioned a study. Well, and then people get angry at me because I didn't quote it. So I apologize, but this time I did. That comes out of PubMed.gov, National Library of Medicine. And the article was the effects of probiotic on the central nervous system function in both animals and humans. And, a lot of you know that I'm also I'm a chiropractor, but I also work with horses and dogs, and I've been studying the different anatomy and physiology of horses, dogs, sheep, goats, even giraffes to some extent, something of an interest of mine. So if you have a pet that you feel over the years or as they're aging is not doing as well mentally, and its temperament is a little different, you might look for a probiotic that's good for a horse or a dog or whatever species we're talking about. The big one here is heart health. Certain probiotic strain can keep your heart healthy, and we always want to keep our heart healthy, considering the #1 cause of disease in the United States is heart disease. Probiotics may help keep your heart healthy by lowering the LDL, the bad cholesterol, and also helping you maintain a healthy blood pressure. Certain lactic acid producing bacteria may reduce cholesterol by breaking down bile in the gut. That's a good thing. Bile, a naturally occurring fluid mostly made of cholesterol, helps digestion. So we want that to be digested properly. And the bile can also get very viscous or thick, and the probiotic will help keep that viscosity at a good flow rate, if I could say that. By breaking down bile, probiotics can prevent it from being reabsorbed into the gut, where it can enter the blood as cholesterol. So it's just helps with some of that mechanism, and it's a good thing. This is not really tough stuff because we're not talking about dangerous products. A probiotic is easy. We could give it to your dog, we could give it to your horse, we could give it to your child, we could give it to a pregnant woman, and no one's going to get mad at us because it's that benign, it's that easy. Probiotics may reduce the severity of certain allergies and eczema, so why not? That helps too. Probiotics may reduce, oh, there's a typo there, look at that, the risk and severity of certain allergies, and even help eczema in infants. And that's exactly what I meant before, that if it was a dangerous product, why do infants sometimes take it? We can't give anything to infants that are dangerous, and we can't give anything to a pregnant woman that might be dangerous to her developing fetus. But probiotics is one of those safe products. And since it gives you so many benefits, I think it's just one of those everyday, why not products. Over 1 million people in the U.S. suffer from inflammatory bowel disease. That's such a huge number. 1 million people have inflammatory bowel disease. Probiotics may help reduce the symptoms of every type of bowel disorders. Well, not every type. Of many types of bowel disorders like ulcerative colitis, IBS, which is irritable bowel, and necrotizing enterocolitis, which some infants get. Here's the caveat. So excuse me, I did make a mistake. You can leave a comment and get mad at me, but I'm correcting it now. But probiotics appear to have very little effect on Crohn's disease. So I'm sorry, but I feel like I corrected that. So give me a little pass on that one. Okay, so probiotics may help boost your immune system and really protect against infection. Probiotics also can help you lose weight and some belly fat. So there's studies showing on that. We do want to see more research and study, but that's interesting. Why not? Anything that might help reduce my body fat and my love handles is interesting to me. Probiotics may help with weight loss through a number of different mechanisms. One is it may prevent the absorption of dietary fat in the intestines. The fat is then excreted through the feces rather than stored in the body. Probiotics may also help you feel fuller for longer, so you don't feel like you just have to keep eating. And some people keep eating way beyond what they should have, instead of eating a smaller quantity and stepping away from the food. But probiotics on a daily regimen will make you feel fuller typically. Not everybody, but some people report that, and that's a good benefit. It might also prove to help you burn more calories, store less fat, all good stuff. Like I said, I make a probiotic. I'm proud of it. It's the type of ingredients and product list that I always wanted. So I made one. I'm still in active practice, so my patients say, what do you want to see me take? That's the one. As I mentioned before, I have one. It's in the description below. But there are many good probiotics out there, so just the one that you feel comfortable, please consider adding back into your life if some of these tips felt like they resonated with you. If not, don't bother. But, there's a lot of good companies that make high-level products that could really be of benefit. Please subscribe if you haven't already, and I'll be continue to put out frequent videos and hope you want to be a part of this. Thanks.